Welcome to this presentation on epilepsy in the dog and how we can follow the VetCompass approach to better understand this disorder. My name is Dan O'Neill. I'm one of the researchers working at the VetCompass programme at the Royal Veterinary College. VetCompass is a programme of research that collects data from primary care veterinary practices right across the UK. And there is a basic philosophy underpinning all VetCompass studies. This philosophy states that the more we know about disease, then the better we can control disease and improve animal welfare. The ideal place to identify lots of good information about clinical disease is in the veterinary surgery. So the VetCompass philosophy is that the cumulative veterinary clinical experience, the knowledge basically of every veterinary surgeon in the UK, can be harnessed by collecting clinical data from vet practices, and these data can be used to improve scientific knowledge and ultimately animal welfare. And it must be remembered that companion animals are a gift to humanity. Companion animals give so much to mankind, ask so little, and it really is our responsibility to improve the welfare of these wonderful animals. By and large, companion animals can live very good lives, while they also bring joy and companionship to their owners. So by increasing the amount of knowledge we have on companion animal health, we can improve the quality of life of these wonderful animals. So, to date, VetCompass has published 15 peer-reviewed clinical papers. Today we're going to look at 2 of these papers in detail to try and learn more about epilepsy in the dog. The first paper we will explore looks at the overall disorder prevalence in dogs, and we use this to get the big picture, to learn exactly how common epilepsy is relative to other disorders in the dog. Following that, we will focus in on a paper that looks specifically at epilepsy in dogs, and we will use this to learn more about this specific disease, how frequent it is, what happens to dogs once they're treated, and which breeds are most at risk. So let's get started, and let's start with the big picture. This is based on a study that was published in 2014, and it looked at the overall prevalence of disorders in dogs and specifically aimed to identify which disorders were most frequently recorded. The study itself involved 148,000 dogs from 93 clinics. From these, a random sample of 3,884 dogs were selected, and information was extracted from the clinical records on every disorder that was recorded. Overall, there were 430 different disorder types recorded and over 8,000 individual disorders. The results of this study showed that the most common body systems affected in dogs were the integumentary, or the skin, the external part of the body, and the digestive system. Neurologic disorders came in at number 1, 2, 3, 4, 5, 6, 7, with 7.7%. So this is still relatively high. However, not all of these disorders would necessarily be epilepsy, as other neurologic disorders might include cognitive dysfunction, so canine dementia, or strokes, or brain tumours. So to explore this a little bit deeper, we would need to look at the specific disorders recorded in dogs. When we look at the data from this perspective, we see that the most common disorders in dogs are otitis externa, which means ear infections, periodontal disease, so various aspects of dental disease, and anal sac impaction. And when we look down this list, even when we get down to number 12, epilepsy is not on the list. So epilepsy is less frequent than any of these disorders. Indeed, we have to follow on down to number 74 in the top 430 disorders in dogs to get to epilepsy. And this study, which really was just designed to look at the most common disorders, identified a prevalence of 0.6% for epilepsy. So this means roughly about 1 in 200 dogs would have epilepsy. There were also 1.1% of dogs that had seizures, but these might often be towards the end of their lives or just a single seizure, and therefore didn't count as being full-blown epilepsy. This sort of ranking gives an idea as to how common disorders are, but actually if we were to investigate the overall welfare importance of each disorder, we would need to look at the prevalence, which is this set of information, how common the disorder is, but also we would need to explore the severity of the disorder. How severe is an animal affected once it has this disorder? And then also the duration. How long does the disorder last? So a disorder that lasts for 1 day versus a disorder that lasts for the whole of an animal's life would have different welfare importance. And indeed, although epilepsy may have a prevalence of 0.6, which may not seem that high, affected animals are quite severely affected, and the disorder often goes on for the entire length of an animal's life after diagnosis. So epilepsy can have quite a high welfare importance for affected animals. This study also allowed us to zoom in on disorders and look at the prevalence across the more common breeds. So when we look at otitis externa or periodontal disease or anal sac disease, we can see that the level across the most common breeds is not equal. For otitis externa, it is the Labrador Retriever and the German Shepherd that are most affected, while the Border Collie is least affected. Periodontal disease shows a dramatically high level of periodontal disease in the Yorkshire Terrier. And anal sac impaction, it is the Cocker Spaniel that is most affected. If we were to use a similar approach to try and look at epilepsy, the results would show that there may not be very many animals of each of these common breeds affected, but it does give a vague idea that perhaps the Border Collie, perhaps the Cocker Spaniel, perhaps the Labrador Retriever and the German Shepherd do seem to be more affected. But really, to get good quality information on which breeds are most affected, we would need an epilepsy-specific study. And this is exactly what we did. This was published in 2013, and it zoomed in on epilepsy of unknown origin, often also called idiopathic canine epilepsy. This study aimed to identify how common epilepsy of unknown origin, or idiopathic epilepsy, was in dogs, to explore what happened to these dogs once they were diagnosed in terms of what treatment they received, and also to look for risk factors, especially which breeds were most affected. For the study, an idiopathic epilepsy case or epilepsy of unknown origin case was defined as an animal with 2 or more seizures and having seizure activity lasting for beyond a year, or an animal that had 4 or more anti-epileptic drug prescriptions given for seizure control. Animals that had evidence of an underlying disease that could have caused the epilepsy, such as a brain tumour, were excluded and were not included as cases, and animals where we did not have enough information on the duration of the disease, the chronicity of the disease, were also excluded. The study population included all dogs that had records within the VetCompass programme from January 2010 to April 2011. And we went looking for cases by searching in the clinical free text, by putting in search terms such as epil or siege or fitting. We looked for specific venom diagnosis terms, and we also looked in the drug treatment tables, looking for drugs such as phenobarbital or potassium bromide. Once we had identified a list of possible cases, these were all manually reviewed. The records were read one by one and checked against a case definition to decide if these animals were indeed a case. All animals that were not classed as cases were used as controls for the risk factor study. So we assumed any dog that wasn't an epilepsy case was therefore not an epilepsy case. For the dogs in the study, we had information on their breed, and we could also use this to say whether animals were purebred or crossbred. We had information on whether they were male or female, whether they were neutered, what age they were, the body weight, and also coat colour. The analyses were completed in a statistical program called Stata 11, and we use these to give descriptive statistics describing the demography of affected animals. So their sex, their neuter, their breed. We use these to describe the prevalence, in other words, how common the disease was, and also to look at therapy, which drugs were used. Risk factor analyses, first of all, used univariable analyses and then multivariable, which are used to take out the effect of other variables within the analysis. So let's look at the results. Prevalence. Prevalence means how frequent the disease occurs. Well, in this study, we had 92 practices and 87,000 possible dogs. and that gave us 680,000 episodes of care. So a very, very large study with a very large amount of data. From this large body of data, we identified 539 animals that met our case definition of idiopathic epilepsy, or epilepsy of unknown origin, and that gave a prevalence of 0.62%. And remarkably, this is very close to the results we got from the overall disorder study, which is very reassuring. When we look at the demography of the cases, we can see that 64% are male, 61% were neutered, 82% were purebred. The most common breeds affected were Labrador and Staffy. And then we could also look at the coat colours. It must be remembered that just because 64% were male, this doesn't mean that males by necessity are predisposed, because it depends on the underlying population. If 64% of the underlying population are also male, then it means that males are no more at risk than females. So this is where the analysis part comes in. When we looked at how epilepsy cases are managed, we can see that 2.2% of the cases had an MRI. So MRI is not a very frequent tool used in diagnosis of these cases. When we look at medication, 87.8% of the dogs were receiving long-term anti-epileptic medication. And this is a good indication that owners and vets treat epilepsy as being quite a severe disease. Long-term anti-epileptic medication is not without its complications in terms of side effects and cost and issues of nuisance for the owners administering the drugs. So the disease must be quite severe to warrant this. 83.7% of the dogs were receiving just a single drug, 15% were receiving 2 drugs, and 0.9% were receiving 3 or more drugs. When we look at the actual drugs used, phenobarbital was by far and away the most common drug used. So 79.5% of dogs were receiving phenobarbital only. And then 14.4% were receiving phenobarbital and potassium bromide. So these are percentages from the subset of dogs that were receiving at least one anti-epileptic medication, the 87.8% of dogs. So our risk factor analysis. So this is looking at risk factors for being an epilepsy case. And because it's multivariable, it's taking out the effect of other factors we studied. So when we looked at sex, male, female, we did indeed find that males were more likely to have the disease than females. In fact, the odds were 1.72 times higher. So males are substantially more likely to be an epilepsy case than a female. When we looked at breeds, there were 2 breeds that were statistically shown to be at risk. The Border Terrier, which was 2.7 times the odds of being an epilepsy case compared with crossbred dogs, and the German Shepherd, which had 1.9 times the odds compared with crossbreds. So these 2 breeds are statistically at risk. However, it should also be identified that some animals may be at reduced risk, and in this study we identified the West Highland White Terrier as having significantly reduced risk, 0.23 times the odds compared with crossbreds. And this is quite an important finding because while studies often focus on breeds that are at increased risk, it is also important to identify the ones at reduced risk in order to get a better understanding of why some breeds get disease and why some breeds do not. When we looked at age, and this is age for having the disease, not age at getting the disease or at first diagnosis, we can see that as dogs get older, the odds of being an epilepsy case rise dramatically. And this indicates that this is a disease of very long duration and therefore contributes to our understanding of the welfare impact of this disease. So, in conclusion, we can state from these 2 studies in VetCompass that there is a substantial welfare impact from idiopathic epilepsy on dogs. This is shown by a relatively high prevalence, 0.06, so 1 in 200 dogs being affected, by a long duration of disease, and by a relatively high severity indicated by the high proportion of cases that get long-term treatment. 88% of cases getting long-term treatment. We can also look at the predisposition, so which breeds are most predisposed. So we have males have 1.7 times the risk compared with females, and among breeds, Border Terriers have 2.7 times the odds, and German Shepherd dogs have 1.9 times the odds compared with crossbred dogs. West Highland White Terriers had 0.2 times the odds compared with crossbreds, so they were much less likely to get disease than crossbred dogs. So I would like to finish by acknowledging the members of the VetCompass team, both in the UK and in Sydney in Australia, who contributed to this study. The primary researcher on this study was Leanne Kersley-Fleet, who did a wonderful job on the main epilepsy study. And I would like to acknowledge all the supporting organisations behind VetCompass, especially the Kennel Club Charitable Trust. Further information on VetCompass can be found at our website, www.rvc.ac.uk/VetCompass. Thank you for your attention, and I look forward to meeting you at a further VetCompass presentation.